Welcome back. I'm welcoming one of our good neighbors from Hoag Medical. This is Dr. Leah Nakamura. Welcome to the show.
Thank you. It's great to be here. Thank you for having me.
It's good to have you here, and you have something really important to talk to us about today. You are a urologist and also a pelvic medicine and reconstructive surgery physician.
Yeah, that's correct. I know it's a whole mouthful, and people oftentimes get confused as to what we do as urologists. I think a lot of times we get confused with neurologists, but we actually deal with the opposite side of the body. So the elimination or all the urinary system. So yes. We treat conditions from the kidney down to the tip of the urethra, or where we urinate from.
Yes.
And some of the common conditions include things like kidney stones, things to do with the prostate, cancers that deal with the urinary tract, like kidney cancer, bladder cancer, and prostate cancer, and then voiding dysfunction or incontinence. And as a pelvic medicine and reconstructive surgeon, I have specialized training and additional board certification to treat those particular conditions like incontinence and pelvic prolapse.
That's wonderful. Well, tell me about urinary incontinence, and what are some of the causes of that?
Yeah, so urinary incontinence is a very common condition. The definition is what we call the involuntary loss of urine, but people know it more like I pee my pants or I leak. Much more common in women, and common as we age as well. Mm-hmm. It's classified into different types. One of the types is stress incontinence, or leaking when you cough, sneeze, or exert yourself.
Or laugh.
Absolutely.
Laugh too hard.
Absolutely. Often happens after we have babies. The more babies you have, the more common it becomes. Another type is actually urge incontinence, which is often associated with having to go to the bathroom frequently.
Yes.
And then when you get that urge, you can't suppress it, or that I gotta go right now type of feeling, and you leak before you get there. Then there's often a mix of the two, what we call mixed incontinence.
Yes.
And then finally, there's a type of incontinence called overflow incontinence, which is often more times seen in men, where they're not emptying their bladders well, so the cup gets really full, right. It tips over, and they're leaking all the time.
Oh, that's right.
Yeah.
Well, and
it's a big spectrum.
Wait too long.
Oh yeah.
Don't wait too long.
Absolutely, absolutely.
That's right. Well, tell me, what are some of the things that women can do in particular to avoid urinary incontinence?
Great question. There are a lot of basic baseline behavioral changes that women can do on their own, starting with just fluid management, making sure you're not drinking excessive amounts of water, avoiding what we call dietary irritants, so not drinking things that will make you pee more, like caffeine, sodas, teas, coffee, sometimes even spicy foods and acidic foods can make the bladder a little bit more irritable.
Right.
Making sure, like you said earlier, that you're going to the bathroom on time, so we call it time voiding schedule, so that you empty your bladder before it gets to you. Mm-hmm. And then for people who get up frequently at night, just doing something simple like stopping fluids 2 to 3 hours before going to bed will help to prevent that frequent waking up at night.
Right.
And another great thing to do and incorporate is a Kegel exercise, or pelvic floor exercise, which will help to strengthen and tighten up the pelvic floor muscles, as well as reconnect the brain and the bladder back again. This is a lot, for people to take in. A great way to kind of actually start and learn more about these things, there is a class available at the Hoag Pelvic Health Center.
Yes.
Called You're Not Alone, Tips for a Better Bladder. And it goes over all of these things in detail about things that men and women can do, and talks about these pelvic floor exercises, and a great way to start.
This is wonderful.
Yeah.
So this is the Hoag Pelvic Health Program. So what's interesting about that is not only do you have the professionals that you can come in, make an appointment with, and ask questions and be assessed, but you also can take classes. Tell me more about that.
So, the Hoag Pelvic Health Program, it's a very comprehensive program with a multidisciplinary team. It's composed of medical providers. There's also physical therapists, acupuncturists.
Wow.
There are guided imagery, massage therapists, sexual therapists, as well as dietitians. And everyone is there to work together to treat multiple different pelvic health conditions. Some of the conditions that are treated include things like incontinence, which we talked about, as well as pelvic pain, pelvic prolapse.
Yes.
And the great thing about this program is that the team understands. This is a very pelvic health conditions, it's a very embarrassing, kind of delicate topic. People don't often like to talk about it.
Right, because it does affect so many areas of your life, as you just mentioned.
Absolutely. And the team is there, and they're there not only, to they're there and available to offer many different treatment options. You know, things as simple as starting off with classes, you know, things like therapy. Not everything has to be invasive. There are things that you can start off with to help with the condition. And
well, it sounds like these treatment options really include a lot of different things. You did mention acupuncture and massage therapy. How do those lend themselves to this kind of treatment?
Oh, absolutely. So acupuncture, I mean, so believe it or not, the acupuncture actually helps to kind of calm some of those abnormal signals coming down from the brain down to the bladder, and actually helps with some of that urgency. And so there are treatment options available through acupuncture in order to help treat what we call urge incontinence.
Yes.
In addition, acupuncture is often used to help with a lot of pelvic pain as well. So multiple different ways that we can incorporate all these different treatments for these conditions.
And massage therapy, the same thing. It connects the impulses from the brain to other parts of your body.
Absolutely, and oftentimes is very good for pelvic pain conditions as well.
Oh,
so.
that's true. That is true. Well, then these are the non-invasive options for anyone who wants to address these problems, but there are surgical and other types of options. Can you just kind of tell me a little bit about those?
So so after behavioral, you know, treatments are exhausting, you know, then we kind of break it down into, you know, sort of the stress versus the urge incontinence. So for things like the stress or that leaking within cough and sneeze, there are minimally invasive treatments like slings or like doing a little injection into the urethra that can actually help once, you know, the Kegel exercise and everything else, you know, doesn't work anymore.
What are you injecting into the
injecting
urethra?
a little bulking agent actually into the urethra.
What do you know?
A very simple procedure that can be done that can actually help. And then for urge incontinence, you know, usually after behavioral treatments are exhausted, next line is usually a medication, something that can be taken to help suppress that urge. And when that no longer works, we can do things like even injecting botulinum toxin or Botox into the bladder to help relax the bladder, or doing, you know, something like acupuncture we talked about earlier, or something even like a pacemaker for the bladder, which kind of calms down those signals that go down and suppress the urge. So
I have even had a friend where cauterizing was used. Is that another option, or
so?
Did she go to the wrong doctor?
No. Cauterizing. So there are. So cauterizing can be done for different things. One is actually for pelvic pain, and then there is a form of sort of heat treatment to the urethra that is sometimes used to treat incontinence as well. So.
Oh, I see. So there's so many options. You don't have to feel helpless. You don't have to feel like the inevitable for you would be to just deal with this problem on your own. You can come to the Hoag Pelvic Health program and learn about all these options that are open to you and take classes to become more aware and more educated about your options.
Yeah, absolutely. That's the bottom line. I mean, this is it's a sensitive topic. You know, people oftentimes don't want to approach their medical providers. You know, the Hoag Pelvic Health program is there. We're all very passionate and we're committed, you know, to work together in order to treat, you know, all these pelvic health conditions. And, you know, it's not like just forcing just about anything on someone. It's listening to the patient, you know, making sure that we're doing everything that, you know, that's in their best interest and getting them better with their conditions. So.
You know, we've been talking about your female patients today and female concerns, but is there a difference between patients' reticence to talk about this particular area between men and women?
I find it's difficult for both. I
Really?
mean, yeah, I do. I mean, you know, both men and women, they oftentimes don't want to broach the subject. It's embarrassing. I mean, and
because you feel like you're out of control.
Absolutely.
This is something that you want to have control over, and you're beginning to feel out of control, and you don't even want to talk about it.
And oftentimes people say, "Oh, I'm too old. I can't. I don't. You know, there's nothing that can be done for me." But that's absolutely incorrect. I mean, there's always something that could potentially be done to help. And so, and it's just a matter of talking over what your ultimate goal is in order to get better and helping you to reach that goal. So.
Well, doctor, how do we find you at Hoag Pelvic Health?
Yeah, so we're the Hoag Pelvic Health Center. There's one located in Irvine as well as in Newport.
Irvine and Newport.
Yeah, absolutely, just attached to the Hoag medical buildings, and so we are there and available. Yeah.
Well, that's wonderful. So we have the number up so folks can call 949-855-1101. And once they call that number, they can reach you or reach another medical professional and learn a little bit more about what's available, even learn about what classes might be available.
Yes. And there is a website that's available too. I know we don't have it up, but it is hoag.org/pelvic-program. So
Pelvic program.
Yeah.
So pelvic-program.
Pelvic-program, correct.
Pelvic-program.
Yeah.
Okay, terrific.
Yeah.
So these are the ways we can find you. And if you go to the website, I'm sure you can see some of these options and classes
Absolutely.
listed, and you can learn a little bit more about really, truly what options you have.
Yes.
Well, that's great. Doctor, thank you so much for coming to see us
Thank you
today.
for having me. Thank you so much.
Sure. And thank you for joining us as well. We'll be right back after this.